left, you're looking up and going right into the duodenum. Ampulla की तरफ you're looking. So left करोगे, so proximal duct को देखोगे, or right. And at this point again your right hand is quite free. ठीक है? और we'll show you as we. लेकिन this is the brownie point really. You're not meant, or you don't have to worry about this.
Yes.
जी, we're fine, we're live. Intubation आप खुद करोगे. Intubation में I won't talk. You will just show me how to do it. Station 1, part 1 of station 1, you will do it and you will show me how to do. And then when you get to the pancreatic body, we then will follow. You have to find the pancreatic duct. Or once you find the pancreatic duct, then it's really simple. Going clockwise will take you to the spleen because आप patient के पीछे हो, right? Okay? देखो. Let's just assume कि ये पेशेंट है, ठीक है. इसको यार हम थोड़ा सा आगे कर सकते हैं. थोड़ा सा इसको कर लेते हैं. चलें, वेरी गुड. ये देखो, आपने स्कोप डाल दिया पेशेंट के अंदर. अब हम पेशेंट के एसोफेगस में हैं. यही है ना न्यूट्रल पोजीशन. अब जब हम 30 सेंटीमीटर्स पे गए हैं तो मुझे बताइए कि पेशेंट के आगे आपके दरमियान में जो आप यहाँ खड़े हैं और स्कोप के ट्रांसड्यूसर के दरमियान में क्या चीज़ है? हार्ट, ऑफ कोर्स मीडियस्टाइनम, राइट. व्हेन यू पुश फॉरवर्ड यू लुक एट द लिवर. हमने ये पहले बात की है कि जब आपको लिवर नज़र आ गया तो यू स्टार्ट टू गो लुक एट स्कोप को. देखो अब पेशेंट के अंदर स्कोप, हाइलम, आईवीसी, ठीक है. और आपने उसको जब पूरा आप गए तो आप पीछे देख रहे हैं, विच इज एयोटा. ठीक हो गया. नाउ अब आप एयोटा पे अगर हो, यू पुश फॉरवर्ड एंड यू सीइंग द पैंक्रियास. यहाँ पे आपने मूवमेंट कुछ भी नहीं ना करना. ऑल यू हैव टू डू इज कि आपने बिग व्हील को अवे किया, थोड़ा सा लेफ्ट किया और आप यहाँ पे आ गए. अब आप पैंक्रियास को देख रहे हो, राइट. हमें ये पता है कि चूंकि हम पेशेंट के बैक पे देख रहे हैं, स्प्लीन कहाँ है पेशेंट के?
Left.
अच्छा, अब मुझे बताओ क्या मनूवर करूँगा मैं कि मैं पेशेंट की स्प्लीन तक देखूंगा.
You fall down, right? Yeah, you go to the right side.
सो लुक एट दिस. बेसिकली पेशेंट के यहाँ पे है ना स्प्लीन, तो अब मुझे स्प्लीन देखने के लिए आई एम गोइंग क्लॉकवाइज. ठीक हो गया. अब मुझे वापस आना है, आई एम कम टू द बॉडी. अब मुझे पेशेंट का हेड देखना है,
Okay.
ये बॉडी ऑफ द पैंक्रियास देखनी है. वो किस तरह, वो मुझे पता है, वो इस तरफ है. सो हेड एंड पैंक्रियास इधर है, बॉडी ये है, टेल ये है और साथ स्प्लीन पड़ी हुई है. वी ऑल एक्सेप्ट दैट, राइट. सो अब मैं इस वक्त बॉडी पे देख रहा हूँ, राइट. अब मुझे ये बताओ कि मैं क्या मनूवर करूँगा. Was it, will it be clockwise or anti-clockwise that will take me towards the spleen
It should be the anti-clockwise.
to get to the spleen?
Yeah.
No.
No, the clockwise, right?
ये देखो, इसलिए मैंने स्कोप बाहर रखा हुआ है पेशेंट के, ताकि आप अगर मैंने पेशेंट के लेफ्ट पे जाना है तो चूंकि मैं बैक पे देख रहा हूँ तो वो रिवर्स हो गया. ओके. सो ये देखो, सो क्लॉकवाइज मुझे पेशेंट के लेफ्ट पे लेके जा रहा है, मैं वापस बॉडी पे आ जाता हूँ. अब मैंने अगर हेड देखना है तो एंटी क्लॉकवाइज. ठीक हो गया. इट्स जस्ट रोल दिस रिवर्स, राइट. ऑल योर्स. गाइस, कैन यू हियर मी?
Yes, we can.
Thank you. So a middle-aged gentleman who has been jaundiced, and on ERCP they found a distal stricture and an abnormal query-looking ampullary lesion, but the biopsies are negative from Aga Khan. They repeated the CT scan and they have found a 2-centimeter lesion in the body of pancreas. So the idea is to assess the lesion and see if this ampulla, which looks abnormal, is anything. The contract of station is, so Om and myself, we have done station 1 before. So the plan really is, from the training perspective, is to concentrate on part 2 of station 1, which is you've looked at your landmarks, you've used your guiding structures in the part 1, which is liver, IVC, aorta, celiac arch takeoff, and then once you get to the body of the pancreas, then the part 2 of session 1 begins. So your your landmark at that point is the pancreatic body, and your guiding structure is pancreatic duct. So the plan is that he'll have to find a pancreatic duct and follow it to the tail and show us the structures there, which is spleen, and then also to follow the pancreatic duct back into the body and into the head. So you've seen the liver, right? So what should we do next?
Move to the clockwise.
So we go clockwise. Okay, so your left hand go relax at this stage. So if you come back, it's always useful to see the beating heart at this, then you know that that's just, okay. So let's start do the clockwise. So the clockwise is your left hand remains there.
I should make this right hand, right?
Yes. So at this point, your right hand is not holding the scope. Look at this.
Yeah.
So this is how it should be. ताकि आपने उसको maneuver. Okay, good. Good. Keep going. Keep going. And what is the landmark that you're waiting for?
For the IVC.
Yeah. Okay. So if you're seeing a portal vein, you've gone down, okay? That's why I always say keep beating hard, then you know that you're at the top. So come back a bit, come back a bit, slightly pull it, okay, and now start doing. So, okay, now you can see the IVC, tip up, no, so big wheel down, big wheel towards you, slightly, okay, so you got the IVC, so keep going. Keep going, we've seen the IVC, so we should now expect to see aorta at some stage. ठीक है, चलते जाओ, चलते जाओ, चलते जाओ. Keep going, we haven't seen the aorta yet. There it is. आपने देख लिया aorta? Good. अब aorta देख ली तो मैं इसको थोड़ा सा बड़ा करता हूँ. Okay. अब जब आपको aorta मिल गया, so what is the next? As soon as you found the aorta, what is the next? Keep it in the sliding push. In the position push 2 centimeter in. Okay. Okay. So this is when we know the diaphragm is coming into the picture, and we know that we're reaching the GOJ. Remember, when you go to the GOJ, remember your cardia goes to the left, so your extreme clockwise torque relaxes a little. Okay. Upper diaphragm bhi aa gaya. Beautiful images. Okay, and you can see the celiac take off. Did you see that? So relax, touch to the left. You can see the celiac coming there. Relax it to the left. And आप कार्डिया से गुजर रहे हो, ठीक है? आप जैसे आपने relax किया, so clockwise torque को हल्का सा relax किया, so can you see the images become absolutely gorgeous? That you can't go wrong with that. So your diaphragm and your celiac will come off there. Okay, good, beautiful. Okay, so अभी आप इसको अगर वहाँ पे रोकते हो ना, so I'll show you the both your celiac as well as your SMA. Slightly to the left, रखो, slightly anti-clockwise, slight anti-clockwise. There it is. Okay. Okay, good. So push at this point when you've seen the celiac artery. The next step is you push 2 centimeter in, and the big wheel which you come towards you relaxes. So it goes away from you very, very slightly. That's a beautiful image. अब यहाँ पे पहुँच गए, you need only 2 centimeter. You can actually look at your scope and just push 2 centimeter inside the patient, and your big wheel goes away from you. Okay, and that's the pancreatic body. So push now. Once you get the pancreas, you push further. Your pancreatic duct is coming there. Big wheel relax for me. So big wheel goes away from you, and you push the scope forward. Push the scope. Stop. There it is. Okay. So towards you, away from you. What is this?
This will be portal vein.
Portal vein.
No, CBD.
CBD. We are in the body.
Yeah. So it should be the pancreatic duct. Oh yeah.
So the three structures that you see as you get to the pancreatic body, the one close to you is pancreatic duct, which is right at the top, the nearest to the transducer. That one there, so transducer, splenic artery, splenic vein. Okay. Now, अब आपको पता है कि हमने ये बात की थी, मैंने ट्रेनिंग्स को पहले भी बताया था, if you divide your ultrasound screen into half, right, so draw a line starting from here right to here, the structures which are on this side of the screen and they come to the midline, there are two maneuvers, and the maneuvers are you push the scope inside the patient and the big wheel towards you. ठीक हो गया? And the structures which are on this half of the screen, it's the vice versa, which is you pull the scope out of the patient or it goes away from you, big wheel. Okay? चलिए, so now that we know कि अगर ये जो मैंने एक मिड प्लेन डिवाइड किया है स्क्रीन का, पैंक्रियाटिक डक्ट अगर इसकी दूसरी साइड पे है तो मैं दो क्या मैनूवर्स कर सकता हूँ. What can I do to get this duct under my transducer? What are the two maneuvers that we can do?
To the anti-clockwise, right?
No, अभी हमने बात किया कि दो, you either push the scope inside the patient or the big wheel towards you. Let's do it. Push करो scope को थोड़ा सा inside the patient and you will see that this will start to come around here. Okay, go on, do it. Go on. Stop. Okay. So we have met the first contract part of the contract. Now what we need to do, remember we've discussed that how are we going to follow the pancreatic duct will now become the guiding structure, and we want to now look at the pancreatic duct, follow it to the tail of the pancreas. चूँकि हम पेशेंट के पीछे देख रहे हैं, so the अगर मेरी फिंगर टिप जो है वो आपका कैमरा है, at this point we are looking at the back of the patient, right? So to get to the left of the patient, clockwise will take you to the left and anti-clockwise will take you to the right of the patient. Okay, well let's do that. तो अब हम आहिस्ता आहिस्ता अगर clockwise जाएंगे, keep going, so we are following, keeping pancreatic duct right under your transducer, it will help. Big wheel को थोड़ा सा relax कर दो, away from you, big wheel away from you. Okay, that's fine. Right, so you start to see kidney already there, right? So keep going, the duct is actually quite dilated, isn't it?
Yeah.
And you will see these splenic vessels, they walk into the hilum. Keep going to the clockwise, the kidney is already there, keep going clockwise. More, and pull the scope out a little. And you will see, do you see these vessels now going into the hilum of the spleen? All right, so this is all spleen for you. Fine, okay, that's okay. So we've done that. Now, as you were, let's just follow these back again. तो अब आपने पैंक्रियास एग्जामिन कर लिया पूरा, आप स्प्लीन के अंदर आ गए, आपने स्प्लेनिक हाइलम, जैसे ही आपने रिलैक्स करना शुरू किया तो ये स्प्लेनिक वेन है, ये स्प्लेनिक आर्टरी है, दिस इज द टेल ऑफ द पैंक्रियास. कैन यू सी दिस? So salt and pepper. Okay, that's fine. So now हमने clockwise किया था, extreme. Now we start to relax and we need to find our guiding structure again, which is pancreatic duct. Well done. Okay, let's do it. हमने थोड़ा सा scope pull किया था क्योंकि हमें पता है pancreas is a leaf. Remember, pancreas is a leaf. So for me to get to the tail of the pancreas, I need to pull the scope out as I go clockwise, right? क्योंकि leaf की हमने वो tip देखनी है ना, right? So therefore now when I'm going back down, I need to start going anti-clockwise and slightly push back. Okay, good. थोड़ा सा push करो आप scope को अंदर patient के, and you will be back at. Okay, so that's the duct coming back in for you. Well done. So again, it's if the structure is here and you want the structure here, what will you do?
Big wheel.
So either the big wheel comes down or you push the scope inside the patient. The two maneuvers that you have in your pocket that you can do, right? Yeah. Okay. No, that's the pancreatic duct. This is still the splenic. Okay. Yeah. Okay, and now I want to see this pancreatic duct falling into head. Okay,
Farooq,
Gigi.
I think a couple of times you said big wheel down and push the
Oh,
scope.
big
and
wheel
you-
towards you. Beg your pardon.
Yeah.
Yeah.
No, no,
Yeah.
but you meant big wheel away from you a bit, right? And then advance the scope.
Yeah.
Yes. Thank you. Okay, just clarifying.
Yeah.
So do you see? So this is so this all is the body and the and this is pancreatic duct as it goes down into the head.
Yeah.
All right. Okay.
So the upper one is the pancreatic, right?
G.
The upper one is the
Yeah.
pancreatic.
Yeah. So we've talked about this
Yeah.
yesterday. The one
Yes.
closest to the transducer is the pancreatic duct, followed by artery spread by the vein. Okay. Okay. So then let's go to the D. Let's have a look at the D1 and then we'll come back. So when we come out of the patient, then I want you to do this one more time.
Yeah.
Is that okay?
Okay.
Endoscopic view हमें दिखा दें.
Okay. And endoscopic view, Eric, उनसे कहें कि
Thank
endoscopic
you.
view दिखा दें.
We have it. Thank you.
Thank you. Okay. तो अभी आप किधर हो?
Bulb.
Are you in the bowl?
Yeah.
Okay. Well, let's stop there.
Right. You have to see it like that, yeah.
Okay. So now stop.
Yeah.
Stop. So pull the scope out of the patient. It's a big wheel towards you. So this is your bile duct. Can you see that?
Yeah.
Relax the big wheel. So big wheel away from you slightly. And you can see that structure there. Okay. So there is clearly some,
Stand.
and you have a stent in there. Acha, isme what I want you to now learn is one hand. So this is, we know this is a hilum, right? You got, you've got portal vein. This is a liver. And this is your bile duct. So ऐसा मैं क्या maneuver कर सकता हूँ कि D1 में रहते हुए I can see a whole of the duct. So the left you go, we talked about this before the station. The left you go, you look proximal of the patient, of the bile duct, and keeping bile duct under your transducer. All you have to do is your left hand goes clockwise and you follow it right down into the pancreas and to the ampulla. Let's do that. So suction for me, please. Okay, so we know that's about lymph nodes. Okay.
Or
Okay, we've just seen the lymph node there. Okay, so suction to keep it up. I'm happy for you to put the balloon up should you feel the need.
yeah, I think.
अगर आपको उसकी वो है.
करूँ?
Yeah, that's okay. Let's get the, so you get contact there. Okay, we've got about contact now. Right, so let's find the duct again.
Yeah.
Yeah? Okay. So we need to start going. Do you want me to show you once?
Should I?
Take the balloon away. Take the balloon away. It's making it. So suction full on. No, suction full on. I think there are some air bubbles in the balloon.
Oh,
It's,
we didn't check it for you.
that's okay. No, there aren't any. You can see the balloon there, and it's going down. That's a balloon. Okay.
The problem here is that the balloon
Right. Let me show you one.
That's why you're not getting rid of the air. If you just suction,
Okay.
it'll help get rid of the air.
So when you're looking at the pylorus, you ain't going to get through really. The idea is you look up. Okay? Right. So portal vein, hepatic artery, bile duct. Now just follow that bile duct. If you do the clockwise, keeping it into the view. Yeah, that's a bile duct. Yeah, keep going, clockwise, and it actually goes into this mass. So I think this is pancreatic head mass. I don't think this is pancreatic body mass. You can see the stent, so your bile duct is right come in, the stent is there. Right? Guys, can we have an F&B, please? Don't open it. So
This is stent.
Yeah.
This is portal vein.
Yep. So your portal vein, pancreatic, bile duct, portal vein, hepatic artery. Okay. Good. So you know, and it walks into this. Has everyone seen in the audience? Om have just shown you a nice example. So and can you see that stent going into the bile duct? So abhi jab Om ka hand left pe jayega, so we will look at the proximal. Go and do it, Om. Left, and so anti-clockwise talk. This is the upper part of the bile duct, and let's do the right now. And the bile duct will walk into that mass. There we are. Okay. So very, very subtle, small movements. Left will allow you to look at the top of the bile duct, the proximal part. The more left you go, you look at the hyaline. The more left you go, you look at the gallbladder.
We lost you. We can't hear you anymore. Okay, you're back.
Thank you. So sometimes you have to go to the level of the patient bed, really, to see the gallbladder. Once you've done that, no movement from the right hand, no pushing forward or bringing out. Scope stays stable, and you start to take it up a bit into the picture, leave it there, and all you do is very slight movement. अगर आप लोग अपनी आंखें बंद करके 1 मिनट के लिए सोचो ना, this is exactly when we started learning the gastroscopy. This is exactly what we did. कि जी D1 से D2 में कैसे जाना चाहिए, राइट हैंड को आप ऐसे लेके आए, लेफ्ट हैंड को ऐसे लेके आए और फिर क्लॉक. That's what we've learned, and this is exactly what you were doing. We're at the D1, we're looking at the top, और जैसे ही मैं clockwise movement शुरू करूँगा तो tip of the EUS scope is slipping. So proximal bile duct के साथ मैं slip करता हुआ नीचे आ रहा हूँ, and I reach the ampulla. This is exactly what it is. So left hand at the top, slight maneuvers to the clockwise, and you will see the whole bile duct. From D1 you can actually see one single bile duct, just follow it right through. अभी आपने देखा कि Om shown us nicely from the hyaline. There are some hyaline lymph nodes. Bile duct में stent था, and all he did from here to right just here, and he walked into the intrapancreatic course where there is a mass, I'm afraid. I don't think this is the ampullary mass. I think this is a pancreatic mass, probably in the head of the pancreas. And so this is exactly what me and Om were discussing. If the mass was in the body of the pancreas, why this patient actually presented jaundice, and also why have they found a very short distal CBD stricture on the ERCP? But I guess this is what his answers now. So Om, if I do the F&B, then up. Is that okay? You happy with D1 now? Okay, good. Make it first.
So, Farooq, earlier we had a question about the importance or the relevance of the sheath and how far to extend it. So maybe as you're doing it, you could comment on that. Thank you.
So I'm doing so I'm using F&B needle. I like to have a sheath out of the scope. Not that I can see it on the screen, but as long as I can see it on my EUS image, and purely because the very reason for this is that sometimes I use the sheath and the bridge to pull me away from the vessels. And if there is for example, if there's a vessel here and it comes out, the needle comes out, and this is the lesion, I use the sheath out and then I bridge it down to get away, and then it goes. So the vessel stays at the top, and my sheath is kind of a bridge that allows me to go above or beyond the vessel. But we'll see it as we go.
Yes.
So liver on your left in your D1. Bile duct at the top. So I think this is probably he may well have some cholangitis. You can see thickening of there's a stent there, thickening, uniform thickening as I call it. There's nothing extraordinary, abnormal about that really. Keeping bile duct into the view, and all you're doing is you're going right. I just want to see the ampulla once because I think they said that it's dented of course. Ampulla looks fine endoscopically. Really nothing major there. Okay, so we've talked about this. Aorta, yes, is your guiding structure in D2 just for the trainees. What do I need to do to see the IVC? We said slightly anti-clockwise. There we are. Dirty blood flowing through happily in there, right? So a very literally 5 to 10 degrees movement in my scope. Nothing, my right hand didn't move, I didn't push the scope forward, I didn't do anything. Jab aorta nazar aa gaya hai, so this is where the pancreas is, okay? So you know that's what you need to do. So therefore, keeping aorta into view, your big wheel slightly down and you start pulling the scope out. You start pulling the scope out. There is some duodenal thickening, we know that. Recently ERCP hua, so the duodenal wall is slightly thickened. All I'm doing is just pulling the scope out, keeping aorta into the view, and the time will come where the pancreas will start to come in the view. It will come around here, okay? In a normal looking, the first pipe that will come here will be pancreatic duct, followed by the pipe at the top will be the bile duct, and let's see if we can do that. We've seen some lymph nodes. There it is. So you've got pancreatic duct already coming into the view as I pull, and there's a bile duct where the stent is. Right? Everyone happy with that? And it's walking into the duodenal wall, the stent is. Okay? Yeah, so there's the stent there, right at the top. Yeah, can you see that? That's the stent that walks right into the duodenal wall. And there is this mass there. I think it's actually the head as well as the uncinate, I have to say, really. Because if I go clockwise to look at the uncinate, I could still see the mass. So we're back into the body of it. And you then examine back to the tail of the pancreas. Right, okay, so we're back into the stomach. Let me just go and have a look. Actually, let me see the body myself. I haven't seen. We know the duct was dilated. We've seen that. So that's the duct which is dilated there. Can we see bile duct from here? Let me just go out a bit. So there is a mass there as well. So we'll be going to the tail, coming back, the pancreatic duct. That's a portal confluence band. Then I was trying to see the bile duct from the body, but we can't. It's actually not a small mass. You could see some part of it actually right here. So I can see it from the. So it actually starts from the body of the pancreas and going all the way into the head. So that probably would explain why they had this problem. So just Eric, इनको थोड़ा सा लेफ्ट पे कर दो प्लीज. थैंक यू.
पीछे डाल पीछे करो आगे वाली आगे.
There's a lot of movement. flange F&B needle driven, please. Thank you. So we're using 22 gauge acquire.
Yes.
Thank you. So coming back to the sheath point, I try to unlock it and try to take the sheath out. If you can, guys, see it. I should start to see the sheath at any minute. Yep, can you see the sheath coming there? So when you see the sheath, you start to pull it back, 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 back. So you can just see the tip of the sheath there. Can you guys see in the audience? And I probably have come back to where I started, but I've now seen, and I've got the maneuverability should I really need to, if there's a vessel there that I need to avoid. The other thing I do, I try to sharpen it, so I'll take this scarlet slightly back into the scope.
So outer sheet is that wheel downwards, that and the upper one is that wheel downwards. And just if you adjust the sheet, because otherwise if you the sheet.
Okay, start it out, please.
Fix it somewhere or just needle out?
No, the needles. Oh, you can fix it if you want. Okay. इसके देखिए सेल्फ टाइम मुझे प्लीज. Thank you.
आहत तो उसको भी निकाली पुराना वाला
वो निकाला नहीं है।
उसको निकाल हाँ निकालना ना उसको चेक करना
अब तक चला नहीं हुआ मैंने।
चला तभी
वो 140 का फोटो था।
चलेगा
नहीं तो बता दे रहे। राम भाई वाले से चलेगा वाले हम पहले चलेंगे।
Oh yeah, measure तो किया ही नहीं. फोटो आ गई वहाँ?
जी सर।
ओके, थैंक यू.
फ्लाइट कौन बना सिम
That's okay. That's okay. That's fine. I'm not in a rush.
Till then I can do this, right? Till then I can repeat the cycle. Repeat the D1 station.
No, let me just take the biopsies. I've got the tumor in the hand, and then you can take it, of course. So that's the vessel right there. So you can use the shield then to go rather than cursor. So if this is the vessel and that's the mass, if the vessel direction is coming this way, you can use the bridge to bridge it down, and you can go into that motion. जी बताइए
सर थोड़ा सा आया है और ले लीजिए
जी
वो लगा रहे हैं
ला 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 और करते हैं इस बार
स्टरलाइट तो नहीं डालूंगी
जी
स्लाइड डालो
नहीं रहने दें इस बार
ये लीजिए
finish one or two stations in a week. So by the time I've made 3 passes, like so we don't waste time. So whenever you go to a second lesion which is not in the same organ, ठीक है, we prefer to use a second. क्योंकि अगर फिर then if you are going to use the same needle, if you don't have the privilege to use 2 needles, go and don't think it's the prime. Go with the metastatic first. If you think it's a metastatic lesion like in the liver or in the lymph node, go for that first.
I think we'll do one more.
Because what happens is primary is going to be a tumor. Where the primary is, if you think it's a pancreatic, you do have and you don't want to try now make it metastatic by going into the lymph node with the second one. So yeah, start with the lymph node, yeah, liver palate.
Obesity
If you have only
BMI of the patients in the US.
जी
BMI.
हाँ हाँ it does make a difference. आपकी काफ़ी चीज़ें थोड़ी मुश्किल हो जाती हैं. Not terribly difficult, I have to say, but they can be.
In 10 minutes will be easier, right?
Yeah.
You can
Hold the scope. आप पकड़ो scope. Don't move it. I'll go and have a look at this. जी वसीम. अब थोड़ी सी जगह देना मुझे. Thank you. Right. देखिए अगर कोर आ गया तो हाँ
और भी ऐसा अच्छा खास आया नहीं है।
ये यूज नीडल तो फिर नहीं दे दिया आपने मुझे.
नहीं यूज तो नहीं देना।
चले निकालो.
ये टच वाली स्लाइड है।
अच्छा जी ठीक है.
इसको मैग्नीफाइंग करूँ 20 पे ले जाओ।
हाँ ले दो. टच में भी वसीम सेल्स तो है.
सेल्स तो काफी है।
हाँ ठीक है चले कोर देखें.
सैंपल को ना यार क्या सोच रहे हो? चलो चलो रीमा अब स्लो देना
कोई सेल नहीं ज़्यादा ब्लड से. Right, let's do one more then. Right, okay, that's all right. Done?
Repeat the
G?
repeating what
I'll be repeating that. So we've got some cells, but the core is we're looking for a bigger core. No, no, I don't think we need to go anything much more different to what we've been doing. हाँ जी, एक और लें. Yeah, that's better. So keep the suction on at all times.
Did we get any tissue on the previous one?
We did get very small, not a lot.
Okay. So, did they make the slides? That's what I meant to ask.
Yeah, that's it. We're in. So now I can see I'm in the lesion. This is a better one. Okay, if you have a good corner, फिर आप बता देना हमें. Okay. Will you wash them, please? In a stream. Is that the wash?
Yes, sir, yes.
Yeah, okay, great, thank you.
Wash देना.
Wash all them, please, thank you.
Wow, ready.
No, it's fine. So I can also access it from here. So if I don't get the nice bites, then we probably will try and do the sample from here. Yeah, although I must confess, What's this? I think it's a stone in the Bangaida.
Sorry? Pseudonym.
No stone in the
Stone,
Bangaida.
CBD, right?
हाँ जी आगे कौन?
वो उसमें कह रही हूँ सैंपल और लेना पड़ेगा।
Okay, fine.
So this is stone. Pancreatic. CBD.
Yeah. No, no, this is pancreatic diet, not CBD. लें जी सैंपल यहाँ से लेते हैं। ये नई नीडल खोली है या यूज है, ये बता दो पहले। नई नीडल। नहीं नहीं बिल्कुल नहीं ना खोलें, जो इस पेशेंट की है बस वही यूज करें। हाँ वही। ये ट्राई करें, अगर नहीं होता तो फिर बताएं। नहीं नहीं वो it's the position of the lesion is very difficult, so we just try it from a different angle.
You were saying it's like involving the uncinate as well, right?
हाँ
Uncinate could be lower for
हाँ हाँ it's a large lesion.
but it's not encasing any vessel.
No, it is involving portal vein. It is actually involving portal vein. इनको थोड़ा सा वो करें आगे। थैंक यू। इनके मुंह पे बहुत ज़्यादा रेजिस्टेंस है। आई एम जस्ट थिंकिंग इससे तो बेहतर है कि हम नहीं इट्स फाइन। लेकिन core है कि नहीं? So we're just waiting for the core, guys. We've got the cells.
Scanty again.
Yeah, no, that's what I thought. हाँ जी।
वो शायद कभी लगा के देखिए, शायद इसमें आ जाए।
Yeah, yeah. It's, Okay, so what was the core? Has the core come? Anything of the core or not? Core आया अभी तक? Tissue आया? अच्छा. That's okay. So if we got the tissue, do we need to carry on? Yep, Eric, hold कीजिएगा scope, please. Just try not to come it out. Mouth से नीचे ना.
जहाँ से लिए ना तो अभी तो लास्ट आपने लिए ना उस जगह पे
यार
सर बोला क्या हुआ नहीं मैं क्लियर कर रही हूँ
you got enough sample? Do we need to take more? ठीक है? Oh, नहीं यार, you got enough. ढेर है देश.
पिछले पीसी है
No, that's okay. Like इसमें तो है ना. We've got now, and we've got, and we actually got.
I have. Are you done from that side?
हाँ जी, we have.
We have some lymph nodes in the subcarana as well as AP window,
Okay.
and I'm doing a celiac plexus block.
Okay. So shall we move it to that?
No, I was just asking. Are
We
you,
done. We
Are
done.
you
So
done?
training होगी भी है Aravind. That's
Well,
fine.
training हमारी हो गई है.
Right.
But I thought we
No,
don't
no,
see-
no,
we
transfer
don't
it down.
see AP windows with lymph nodes very.
अब मैं ये वाली
सर बीच में रख के इस तरफ
बीच में रखे
हाँ इसको बीच में रख के नीचे थोड़ा सा पीछे हाँ
ये।
आया ना सर इधर बीच में रखो नहीं
ये ना
हाँ हाँ
Wow.
या फालतू भी क्या मतलब जो यूके
की
में क्या होता है?
फायदा है? Wow. Look at this.
He taught me
एक
this
बैठ
technique.
के
आदमी इसको बैठ के कर ले. किधर है वो? उनको बता दें कैमरा दूसरे रूम में मूव करना है. ये माइक उतार दें प्लीज. कैमरा उस वाले रूम में मूव कर दें प्लीज. ये उतार नहीं, मैं लेता हूँ. ये उतार दें.